What's up, Facebook? All right, welcome. Having some issues on Instagram, but it's okay so far. All right, so we're here talking liposuction, fat transfer, how to avoid tummy tuck, how to get rid of that hanging belly, how to avoid looking like you're pregnant. You know, I mean, this has got to be one of those things that, I don't know if they told you when you were in school, but anytime you see a woman, you never ask her if she's pregnant until after you've had testing. And this was on the OBGYN ward. You know, you're just never supposed to ask a woman that they're pregnant, because if you're wrong, that's embarrassing.
Yeah.
And I mean, it feels bad. You know, I feel bad for the person, but we can solve those problems. That's the cool thing. So if you've been embarrassed like that, it's, you know, it sucks, but you know, we can solve it so it never happens again.
So, you know, it's funny, it's like guys should never do that, right? But it's funny when girls do it to other girls and you overhear it. That is funny. I was working with a doc, we were in the ER, and one of the nurses came walking in, and the doc goes, she was a female doc, and she goes, "Wow, congratulations, how far along are you?"
Ooh.
And the countenance on her face just kind of like sunk, and she's like, "I'm not pregnant." And everyone's been there, right? Everyone like feels that emotion, understands what it's like to, you know, not be in your fighting weight or your tip-top shape. Yeah, it was.
So we connected with somebody.
Fun.
Johnson Vonda says, I look like that woman on the top. She said it's pretty embarrassing. You know, we get it. I mean, so I hear that a lot. You know, especially with these women that have these bellies that's sticking out in the front. You know, when your belly sticks out further than your breast, it's kind of an indication. Unless you're very big, then people assume that you're just big. But when you're leaner like this and your belly is just sticking out, people, you know, they make that assumption that you're pregnant. So Susie from My Shape, she is here and she will be answering questions for any of you that we don't get to. What's up, Stacy? Stacy's a previous patient of ours. She's had multiple procedures, and she's probably one of the most experienced liposuction persons I know.
She really is.
Oh wait, we're not even live on Instagram.
Uh-oh.
Okay.
There we go.
Tricky, huh? Speaking of Tricky Mickey's coming back.
Oh, did she schedule again?
Yeah.
Sweet.
Okay.
So you guys, you want to have a party? Get hooked up with Tricky Mickey. She is just a party in a bottle.
I don't know if our Wi-Fi is not connected or something. It's having issues with the internet. So if you guys have any questions or concerns about liposuction, you know, the first step is if you're interested, you want to go get a quick quote. If you're up on Facebook, we have the quick quote link up in the post. And if you don't want to go there, you can go find it on our website, myshapelipo.com. So the first step would get your quick quote so you can get your pricing. You know what it's going to cost for the average procedure. And then if you like that and you're interested and you want to move forward, then the next step is getting a formal consultation. The formal consultation is where you get to speak with Kayla or myself. The cost is $100, but we talk to you for about 15 to 30 minutes, review your pictures, develop a plan, make stuff happen for you.
Yeah, I mean, it's an amazing time to do it. Gas prices might be going up, but who cares? Let's get you looking good for the summertime so you can, you know, go to the beach and spend time with your loved ones.
Or stay at home by the pool and look good by the pool.
Yeah, I was just thinking.
Right.
I was just thinking about that. So, you know, there might be quite a few staycations this summer if gas prices keep going up. Yeah, what do you guys plan on doing this summer? Let's get you to the beach. Let's get you to the pool. Let's get you trimmed up so, you know, you can be super active. Let's get you in shape. You know, it's funny. A lot of people have a lot of reasons why they do liposuction. I like to hunt, and hunting is very demanding. And anyway, a buddy of mine that I like to hunt with, he kind of let himself go and got way out of shape. And so I said, "Wow, dude, we're gonna go hunting next year. You got to get up here, and I got to get you in shape." And he goes, "Well, how are you gonna do that?" I go, "I'm gonna do liposuction on you." And he goes, "Really?" And I said, "Yeah, guys do it too." So I took him from like a size 40-inch waist to a size 36 overnight. And yeah, his wife was super pleased with me. Yeah.
That's awesome.
So
it blows me away how much we're able to change the waist size. I mean, I've had patients that have lost like 12 inches around their waistline, which blows me away. I mean, that's like a whole new wardrobe. I mean, you can't wear anything the same anymore. So Lucia asks, she did her lab work. Can we release the results to her? I believe that you need to allow us to see the results. I believe you always have access. Do you know anything about that?
So she probably got sent to our system,
Right.
right? And so she probably just needs a copy of them. So yeah, we can.
I mean, we can definitely get it to you. I mean, we're not holding it from you.
Mhm.
Okay, Shelly, that girl says, hello. Can this be done with some fibrosis from prior tummy tuck?
Oh, that girl. Oh, that.
Shelly, that girl.
That girl. Yeah, yeah. Absolutely, it can. Yeah, if there's fat in an area, and we can get access to it, then we can absolutely take it out, and it's going to look a lot better. Yeah, fibrosis is one of those things that occurs after you've had an intervention. We do a lot of revisions and a lot of people that have had tummy tucks previously, and so yeah, when we get done, all of our patients are super stoked with what we can do for them.
You know, the interesting thing with tummy tucks, I've done quite a few. So a lot of people get the tummy tucks and they simply just don't do enough liposuction, so they leave you boxy in shape. So if you don't have that hourglass figure. So when we do liposuction, we can create those shapes for you. And interestingly enough, for some reason, the fat comes out really easily and the results are amazing after you've had a tummy tuck. So, I wouldn't be too concerned about that. Fibrosis, scar tissue, it's possible that you have it. In most cases, it's not an issue with tummy tuck specifically, because I think it's because they just don't do enough liposuction.
No,
There's
they
not a
don't.
whole lot there.
They do a little bit, they pull it tight, and then they just rely on that tension to kind of like keep everything nice and flat.
Okay, there was a Spanish one in here. Did you see that?
No lo vi. ¿Qué
Okay.
dice? Yo quiero saber el promedio de precio de una lipo de entrepiernas. Bueno, so what she's asking is, what is an average price for the inside of the thighs? So cada persona es diferente. Tenemos algunas categorías de que según su tipo de cuerpo y los precios pueden variar. Tiene que usar nuestro Quick Quote sistema para identificar qué tipo de cuerpo tienes y puedes escoger el tratamiento en cuanto a las piernas y vas a saber. Es bien fácil, tiene que ir a nuestra página de web.
So let's see. Johnson Vonda says I have to take care of my hernia first, and then you'll be in our office. That's awesome. Sometimes that's your path. Some people got to do that stuff first. Minor hernias are not a big deal. However, if it needs to be repaired, it should be repaired prior to liposuction.
So Genesis asks, how can I schedule an in-office consultation? So this works really good. The way that the system that we got set up, we can absolutely, between both of us, we look at your photos and we can really, because we've seen so many body types, we can tell where you're going to need the treatments and what type of treatments you're going to need. Now, if you need that, personal interaction to just feel comfortable, I get it, no problem. We can try and do that, but we did everything online and via messaging and video conferencing, just so we can I don't know, with COVID it kind of put a lot of restrictions on it, so people weren't traveling as much. So that's why we did it this way, and we found that it works pretty good.
Yeah, I would try the current process that we have, the virtual, where we're doing with photos. In most cases we can handle the situation, but if you really need to, or we feel, even when we do the consultation, there might be stuff that seems weird or we need to touch to really get a good idea of. So if that's the case, we can always do something in the office. We just don't have standard schedule in the office.
So Glam Time LV asks, is it true that being awake doesn't allow for as much fat to be taken out, or is this a myth?
Total myth.
So it's a myth, absolutely. Every clinician is different in the way they practice, and we found that if you're awake the entire time and we can tell that your body is doing well, we can get really, really aggressive.
Yeah, I mean, you just see our pictures. It's not like you have to believe us. We're getting a ton. The medical term is a shit ton of fat out. That's what we're getting.
Yeah, that's the clinical term, absolutely. A lot of things in medicine are always done because it's traditionally done that way, and so that's how they trained, and that's how that's how they feel comfortable practicing. That's how they're going to do it. We found a different system, and it works very well for us.
Hola, ¿cómo están, Angelica? Is that right?
Yeah, good job.
Local anesthesia is numbing injection, right? Yes. It's also called tumescent technique if you want to Google it.
Yeah, and it was invented by a dermatologist.
back in the
So,
80s.
Yeah, just so you know.
Interesting thing about the history of liposuction is some form of liposuction has been around for a couple hundred years. They actually used to like make an incision and just cut out the fat, and that didn't work out so well. Quite a few people died. They had a lot of bleeding issues. So one of the big issues with liposuction and historically has been the bleeding issue, which was solved through this tumescent technique. Through the tumescent technique, we use medication called epinephrine that constricts the blood vessels and essentially pushes all the blood away from the area. So you'll see in the pictures when we show pictures of the fat that the fat, there's very little blood in there, and when the fat is yellow, there's like just a couple drops of blood in there. There's very little.
Yeah, and to take that one step further, you being awake, if you had some sort of major bleed, basically you're not going to have enough red blood cells to carry oxygen and nutrients to your brain, and so you're going to pass out and have neurologic problems. So by you being awake the entire time, we can gauge how well your body is responding, and we can make sure that you're tolerating this well, and we can get super aggressive with the amount of fat we take out.
So let's see, Ninel Alamonte sent us 200 stars.
I'm not sure what the stars are, but thank you so much.
Let's figure out what that is, but I don't know what that means. But that's kind of cool. I appreciate that, whatever it means. I like likes. It gives me a little dopamine hit,
So Glam Time LV, she says your work is amazing. Yeah, we have some really good, amazing testimonials. Yeah, and if you jump on our support group, you can connect with a lot of these patients and you can talk to them and get their pictures directly. You can jump on our website and you can absolutely do your homework and see the befores and afters. That's probably the best marketing thing ever, is having befores and afters from people that actually are patients. Oh, what's going on?
Just you're a little dark in the picture. So
Oh yeah.
maybe
No,
turn
that's
it up
just
a
my
little bit.
tan. I've been sitting out by the pool. I'm just kidding. I haven't. So
Turn it this way.
yeah, Glam Time LV. You're hoping to get your procedure at the end of the month. Listen, let's get it started. Go ahead, jump on the quick quote, submit your photos, or look at, categorize yourself, figure out what areas you want to treat, and then when you're ready, schedule a formal consultation. You get to talk to Trevor and myself, and then let's get you rolling on your goals.
Heck Marie says, does lipo hurt? So everyone is a little bit different, right? And everybody tolerates things differently. So pain is one of those things that is very subjective. One individual could say it's the worst pain in the world, another could say they're laughing throughout the process. So we've seen the full spectrum, and there is no right answer to this. It's theoretically it can hurt. However, it's possible that it doesn't hurt either if the numbing medication works properly. But ultimately, what is this worth to you? I mean, what are you willing to go through pain-wise to get these kind of results? And that's the thing really you need to ask yourself is what is it really worth to you, and how much are you willing to go through in order to get these results? Because the truth is that these are not easy, and afterwards, if you don't maintain the results fade away. So you have to start living a healthier lifestyle, which takes effort as well, and some people might call pain, right? Where you have to go through the effort and make sure you're eating properly and doing exercises and doing everything that you need to do, because that's an essential part of getting success.
Absolutely. And keep in mind that we're going to be right there with you, okay? And we're going to be making sure you get through this procedure, and we're going to try and make it as comfortable as we can. So, we're in this together. We're a team. We want you to have a good experience. We want to make sure that you have amazing results, and we want to make sure that when you go show off your results to whomever, that you speak in a positive manner. So we're going to try and make this the most pleasant thing for you. Okay.
Terry Segovia, it was a pleasure speaking with you today. I did her consultation earlier.
Oh, sweet.
And I'm pretty sure she placed her deposit. I think, Terry, she said she was going to, but anyhow, we'll see you soon. I'm excited for you. It's going to be awesome results.
So Devane asks, can you work with a patient that has mesh that was put in for a ventral hernia? Yeah, absolutely. So give us a call and we can talk to your case, talk to you directly about your case. As long as it's not large and protruding, that mesh and the fibrous layers will absolutely impede the bowel from sticking out, and so there's not a high propensity for a bowel perforation.
Yeah, it's really a different layer. The mesh is put on top of the muscle, and the muscle is below the fat. So if we do our job right, we're not even touching it.
Yeah, absolutely. Yeah, you know, every once in a while we might get close to the abdominal wall, but most of the time we stay away from the abdominal wall while we're moving our instruments. That was an interesting thing. I did a medical clearance conversation with a guy yesterday, and he said, "Man, I'm really nervous. Like, you know, I don't know about this." And I said, "Well, listen, when you've played with stuff, these instruments, as long as we have, yeah, we know exactly where the tip is the entire time, and so
Yeah.
you know, you just trust in the guy that's been doing it."
No, I think, I mean, it's basic technique, right? But if the angle is such that you're going towards the muscle, it's possible for you to perforate it. But if you're going parallel to it, it's almost impossible. I mean, it's just technique, really. But Stacy's leaving. Thank you for coming by here today, Stacy. Every day we appreciate you. And don't forget to join the private Facebook group, she says. You know, many of our previous patients are on our private Facebook group. This is Stacy behind us here. And they are there sharing their stories as well as updating their photos. And you notice that all the pictures that we're showing behind you, they're not like Photoshopped, they're not perfect background. Sometimes they're wearing clothes, sometimes they're not. These are Stacy posted this, and she posted them on Facebook, so they're there for you to see, and she's, you know, available to communicate with, and many of our other patients are there as well. And the hopes is those of you who are interested in getting this procedure, those of you who are questioning and you're not sure what's right, what's wrong, what's true, what's fake, those of you need to connect with somebody that has had the procedure. It's almost like having a friend or a family member that have had the procedure. You know, and we'd like to call it My Shape family. So once you join our family, you know, you get communication with all these people.
And I love it when you know, the potential client says, "Oh my gosh, I saw those pictures from that one girl, and that looks just like me."
Yep.
And so I know if she can do it, I can do it, and it just adds a sense of comfort. You know, it just decreases the anxiety, and it's a way for you to connect with others that have gone through the process. And so, you know, whatever question that might come up, you have direct access to them, and you can say, "Hey, well, what did you do in this particular case?" Or how did you deal with this when you were going through the post-op care?
Yeah.
And you know, it makes it very easy and seamless.
Paula Herrada, I saw your name on the schedule recently, I think. She's coming up in a couple weeks. Super exciting. The Spanish one. Hola, está incluido en el precio la casa de recuperación for the recovery house?
Yeah.
Nice.
Yeah, that boy.
It is included when you pay for it.
Yeah. Es una opción. Podemos pagar por su hospital allá en esta casa de recuperación. Creo que cuesta $1,250 por como, what was it, 3 nights, 4 days?
Yeah, 3 nights, 4 days. So it's actually a really amazing deal because it's 3 nights, 4 days. So you fly in the night before, you get checked in, and then you stay 2 nights afterwards. Lexi will transport you to and from the airport, to and from our office. She supplies healthy food and drinks, as well as a secondary garment and 2 lymphatic massages and whatever other treatment stuff you may need.
Yeah, and so and it's nice. Here's the most convenient thing. Okay, so when we do, let's just say an abdominal 360. Okay, your core is connected to so many different movements of your body, right? When you're recuperating, you know, sometimes it's inconvenient to just run down the drugstore. She will, you know, she can do that for you. She can take care of all of your, you know, your whatever you need. So it's awesome.
Okay, so this is an interesting question. If we want to get BBL or transfer, this is Lily Lotus Doll on YouTube. It says if we want to get BBL or transfer to the butt, is it okay if we do tummy? Can we get lipo and get it injected into the butt area? But if we have tummy or fupa, can we still get? Yeah, so it doesn't really matter necessarily where we take the fat from. However, it's better to when we do fat transfer to the butt, we need to carve out the shape of the butt, which means that we need to be able to take fat surrounding and usually the waistline area, so like the sides and the lower back area. So you can see how this person here, if we would have just added fat to the butt, it would have not had a good shape. It would have just been big blob. So when we did the liposuction surrounding the area, we were able to shape the butt, then add additional volume to it. And so in general, that's what we recommend for the fat transfer, particularly to the butt. When you do the breasts, you know, it's the same concept. When you make the belly smaller and then add volume to the breast, that smaller belly in the breast coming out, it further enhances the proportions.
So Erica Flores asked, do you you a post-op visit the day after the procedure? Yeah, so after you have the procedure done, we want to keep an eye on you, we want to check on you. If you're not staying at Lexi's place, you come into the office and you get a lymphatic, basically treatment, and it helps with, keeping the lymphatic system flowing, and that's a good idea. It's a good way for us to check on you and make sure that everything is going okay.
D Baby says, do you do virtual consultations? Yes, we do. But so to start out though, you can do our free quick quote, where you just jump on there and it'll give you a basic quote for our most common procedures. And if you like that and you're serious and you want to move forward, the next step would be a formal consultation. That is $100, and we'll be able to speak with us and we'll be able to evaluate your specific situation.
So Erica Flores, your name looks super familiar, like maybe you're a previous client. I know there are a lot of Ericas and a lot of Floreses out there, so I hope that if you were a previous patient and we didn't recognize you, I'm sorry.
Okay, Agnes says, I'm sending you my pictures to see if I can get next month how long I need to wait to travel by plane after the procedure. So Agnes, we're normally recommending that you stay 48 hours at minimum afterwards. Some people like to stay later. It's really kind of challenging traveling because of the potential messes that you can make. After this procedure, you drain a lot of fluid and it gets kind of messy, so it's better to wait 48 hours for that.
So Erica says she's actually coming in April, which is fantastic. Okay, awesome. Can't wait to see you. Maybe that's why your name sounds familiar, because when we're getting people ready for their procedures, we make sure that we do a pretty good background check on their medical history, make sure that they're an appropriate candidate. We ask you to get blood work, and oftentimes that's the rate limiting step on how fast we can get it. So if you commit to a date and we send you a lab request to go get your blood drawn, we have to review it and we have to make sure that there's not any weird stuff going on with your body, okay, and review your medical history so that we can say, yep, okay, you're good to go. So that's probably where I saw your name.
Yeah. Agnes, as far as sending pictures, in order to send pictures to us, you got to do the paid consultation.
Yeah, I'm sorry, I screwed that one up, and I said that there was an option to submit photos.
Yeah,
on the quick quote. There's not.
Yeah.
That comes in with the formal consultation. So you take a look at the quick quote. You put your body into whatever you see what category you fall under, okay, and then it gives you a bunch of different options on the areas that you can treat, along with photos. There's photos there that help you identify those areas, and then you can have a pretty good idea on what it's going to cost you as far as the treatment.
And we also have a ton of information there as far as like frequently asked questions. We also have video format so you can watch the answers. So take advantage of that stuff. Obviously if you're here listening to us now, you're going to get a lot of those answers here because, in these lives we repeat a lot of the frequently asked questions.
Yeah, and you can reference it multiple times. I mean, so you can be well informed as a patient. The most important thing is to be, make sure that this is the right procedure for you, make sure that you understand all of the risks, make sure that, you can get the anxiety level down so we can go to work and just have a good process.
All right, so we got a little education here. Johnson Vonda says, I believe the stars help your videos to go viral and recognize, plus you will get paid when you reach a certain amount of stars.
Okay, so this is a very, direct solicitation. Can you guys hit us with a bunch of stars?
Yeah, hit us with stars.
Right now, okay?
I still don't know what it means, but I want stars.
Exactly.
I want it.
Mm-hmm.
Okay, have you ever dealt with anyone who couldn't handle knowing that they are having a procedure done and panicked?
Oh, you're talking about anxiety disorder. Yeah.
Where he had to put them to sleep. Well,
sort of like claustrophobic.
Yeah, there are some people, but I mean, typically those people don't make it to our table. So usually they know who they are. But with that said, I've had some people that were super motivated, like, I don't care, I'm just gonna do this because I want it so bad. And we deal with it. It's like everyone's different. We just do the best that we can to make it work. That's it.
Listen, and we pull out all the stops, okay? We really do. Anxiety is one of those things that's very real, and we do a really good job. We have not had a patient, stop their procedure because of anxiety. We've been able to get through everyone.
And we don't have the potential, since this is an office-based procedure, we do it under local anesthesia, we don't have the option of doing general anesthesia. So it's not in an operating room, it's not in a hospital, it's an office-based procedure. It's significantly safer that way. That's why we can do it in an office. But there's not an option to be put to sleep. We do use anxiety medication if needed. However, there's side effects to the medication as well.
So this one says she's coming in from San Diego. How long does she have to be here? So listen, the way that what we found works very well is if you get here a day earlier, it helps with the anxiety level. Okay, so so much of this is going to be predicated on how well your body tolerates it, and anxiety is one of those components that's paramount in order to get through a procedure and get very aggressive with the liposuction. So we want you here a day before, check in at the office, finish out the paperwork, come in for your procedure the next day, and then we want you to listen. We want to take care of you, okay? So if you stick around for 48 hours and get a lymphatic treatment, we can keep an eye on you. If something needs to be addressed, we're right there. It's tough to take care of people that are out of state. We do it, but it's a lot easier if they're in state.
So Agnes says the next week if it's possible. So we don't, obviously I don't have any of the scheduling stuff here right now. So if you want to schedule anything, you got to call our office. The girls are there right now. I know Susie is on this live, so maybe she can connect with you directly.
Absolutely.
Okay, Leticia asks, what A1C level do you recommend?
So we've made.
Why don't you explain what that is first, so people know it.
So A1C refers to the hemoglobin A1C, and what they do is they analyze the red blood cell and they see how much sugar is stuck to that red blood cell. Since the lifespan of a red blood cell is 3 months, they say, okay, well, if your hemoglobin A1C is at this number, we can suspect that your diabetes is poorly controlled and we need to do more aggressive intervention. So the reason that that's important is we want you to be like right at 8 or below. That's kind of where we've come up. We'd like to be closer to like the lower 7s, but yeah, with some extenuating circumstances, we go all the way up to 8. And what that's going to do is that's going to allow your body to heal a lot better. You're going to have a lot better, recovery process, and your body's going to respond a lot better. So hemoglobin A1C is one of those markers that we can tell how well your diabetes is controlled.
Yeah, and it's kind of an indication of how your healing potential is. So the higher that A1C level is, the less potential your body has to heal. So things take longer. You have a higher potential for infection, and then basically any other potential complication is just elevated. So the lower you can get that number, the better it is for you.
So First Class Honey comments, oh, love how informative you guys are, super personal. Thank you. With a tag name like First Class Honey, I bet you're super personal as well.
It's like important that you as individuals who are looking for these procedures, that you get accurate information from the people that do these type of procedures. And I don't think that there's any other source out there that the practitioners, the ones that are actually doing these procedures, are getting live and answering question and answers like this. So I think that's pretty amazing. And we do this for free, but if you want to get on the phone with us directly, it's an individual. We do our formal consultation, and we can evaluate these things in more detail and give you more information specific to your body.
So somebody on Instagram said, well, I'm coming from out of state, I'm coming from Massachusetts. So interestingly enough, we've done people from all over the country. And in our Facebook support group, there are a couple of females that coincidentally were from Massachusetts. Recently, one that I can think of, I think was from Worcester. And you could probably reach out to her and maybe you can get some FaceTime with her, because I assume you're either probably from Worcester or you're from Boston or Framingham or one of those places.
So, there's the question earlier about pubic area. Do we treat the pubic area? And yes, we do treat the pubic area. It's included in any of our abdominal procedures. And then on YouTube here, there's a person that says, hey guys, do you, let's see, the one thing that you're concerned about or you're turned off about lipo is a side effect of incontinence.
Incontinence?
Yeah, I've never heard of that even as a
No.
side
So
effect.
the incontinence probably comes from the general anesthesia. Yeah. So that's one of the requirements when they put you under general anesthesia. when you go into the PACU or the post anesthesia recovery room, one of the things is your bowels have to start working again, because they take you to as close as death as they can, and that's just one of those signs that your body is actually returning to normal.
So from our perspective, it's never happened. I've never had a patient that had any continence issue. I've never even heard of that as a side effect of liposuction, so I'm not sure exactly where you got that information from, but I don't think it's accurate. Lily says, okay, I want to take that deal. All right.
Take what deal?
I don't know. She must have been talking. We were just, people respond at the time. Let's see, I'm fat but haven't had kids, so I want kids, so I see you're gonna even slim me down the sides. Okay, so Lily, it shouldn't make any difference whether you have kids now or later. This is completely irrelevant when we're talking about liposuction. We're taking fat out of you, and the fat doesn't come or go, depending on whether you have kids. So from a personal experience, my sister, I did full body liposuction on her, and she had kids about 2 years after. And her experience, she told me that she gained weight obviously with the pregnancy, but then when she got back down to her the weight that she was pre-pregnancy, all the results were about the same. Plus she had some minor stretch marks and things of that nature. Is the numbing effect similar to the numbing that a person gets with a C-section? Technically, yeah, they're going to use lidocaine, the same stuff.
They are, but I think with the C-section, they do probably an epidural, right?
Yes, they would do an epidural,
yeah.
but I mean,
so it's different.
Yeah.
Yeah. So the numbing process, that what we do, what tumescent liposuction is defined as, is we take lidocaine, epinephrine, and normal saline. We create little holes in the areas that we're going to work. So we go through the skin with our instruments, and we inject the lidocaine and the epinephrine and normal saline into all areas of the fat. Mm-hmm. And what that does is it gives it a local anesthetic effect. Local, not general. And it's different than doing a lumbar puncture or an epidural nerve block. It's different than that.
How long is the recovery on the chin? It's pretty quick. It's not, the chin is it's an area that it's not going to restrict you from doing things. However, the garment to put compression on the chin, you're not going to like. And you're not going to want to be seen in public with it just because it's kind of funny looking. It covers your face, but pain-wise, it's not a big deal. If you're working from home or remotely or whatever the case, you can go back to work. And if you don't mind the compression garment, and a lot of women, they like to, they're good at covering up everything, right? So they put hats on, they wrap with scarves and stuff like that. So
you could turn Muslim for a couple of days if you wanted to, and just wear one of those traditional veil things.
But I just did 2 chins today, so it's a real quick and easy procedure. Patients walk out, you're feeling fine.
Heck Marie 25, okay, thank you. Yeah. Hey, listen, jump in the comments. I'm curious to where you're from. You're in Massachusetts somewhere, let us know. I lived out there, went to school out there, so.
Johnson Vonda says, for those suffering from high blood pressure, do you suggest taking medication before the procedure?
Yes, listen, there are certain medications that we will counsel you on to not take the day before, the day of. I mean, it's on a case-by-case basis, but hypertension is one of those things that, you can take your medication and you'll be fine, okay?
Yeah, we got 50 more stars.
Oh, she's from Leominster. I think that's how you say it. Man, you guys have such weird, goofy names on all the towns out there. Worcester. The way it's spelled, it's like Worcestershire.
Is that British?
Where's
that name come from?
I don't know, but cool. All right. Well, listen, get your quick quote. Submit. Request a formal consultation. Let's talk. We'd love to take care of you.
Someone's saying happy belated birthday. Thank you.
That's a yo, dude.
Jessica says, "What's up?"
Big old beer snob, whoever that was.
Oh, that must be O'Mel.
Is that O'Mel? I think it is.
He always posts everything is beer.
It's close to Worcester. All right, yeah.
Okay. Right. Do you use a Foley catheter? No, Foley.
So you're awake the entire time.
If you have to pee, you get up and go to the bathroom.
Absolutely.
Seriously, this procedure it's not that big of a deal. We want you to walk to the bathroom because you're awake, and we want you to be drinking throughout the procedure because it keeps you hydrated. it's so much safer that way. And Foley, if you are, so just here, did you ever do surgery?
Mm-hmm.
I did tons and tons of surgery. We did Foley catheters on patients, and it's like, they put you to sleep, okay? And then women, you open your legs, just like you were at the OBGYN. And all these people are around prepping you for the surgery. You're asleep because they put you to sleep because you don't want to be around when you've got your legs splayed open, but your legs are splayed open with showing all your parts, and the nurse is in there jamming this thing in there. Like literally
such vivid imagery,
you know. And it's I watched this. I did this for years. I watched it, thousands of times. You don't want to Foley. I don't know. Sometimes when I'm driving cross country, I was like, it'd be nice to have a Foley, right?
Yeah.
Okay, Johnson says, I've heard about fat transfer to the under eyes. Is that possible?
How to do it on like the
yeah,
upper...
they use it as a filler.
Yeah.
I don't do a lot of the fat transfer to the face. It is possible. I've done it in the past, but the results were so, they weren't predictable enough for me personally. So I didn't really want to. I didn't want to deal with people being unhappy with the results because they were unpredictable. So I try to stick to things that we know we can do exquisitely well and get excellent results nearly every time. Okay, after watching the videos for the quick quote, what else is to be done to get a quote? So Aram, if you've done the quick quote, you're happy with the price and you're ready to move forward, the next step is getting that formal consultation. You can find that link on our website, myshapelipo.com. And you can submit photos, and then we'll do a phone call with you, and we'll just solidify and confirm the quote that was given to you on the quick quote, answer any questions that you might have, and make sure that you understand exactly what we're going to do.
So Larad 75 says, how much for fat removal of the double chin? Okay, so this is one of those interesting things where you take fat out underneath the chin, get rid of that bullfrog, okay? And then with the post-op care, your skin retracts and it comes together, and it doesn't look like you have that genetic problem area that you were born with, okay? It's about $2,500, okay? So you put it into context. If you're gonna go into whatever med spa, they're gonna say, oh yeah, you'd be a great candidate for Kybella.
Don't do Kybella.
How many people have heard that? Kybella would be awesome for you. And Kybella is just 2 treatments. And you'll spend probably $1,400 for the 2 treatments, and you'll have, very goofy, weird results. You can get an infection from it. I mean, it's just, it doesn't work very good. But if you come, $2,500, we create some holes, some access points, we suck it out, then you can guarantee that it gets taken out uniformly.
So I'm just going to show you on myself, but you can see the picture behind us, what we actually do and how we create that jawline. But when we're doing this, you're going to draw a line from the corner of the ear to the corner of the mouth. That's how high we go, okay, right there. So we're going to get everything above the jawline, and then we go everything into the neck. So you see what happens after we do all that. So we go above the jawline and below the jawline. And ideally, we're going to create the shape of that jawline, because you see when the people gain that fat in the neck area, it goes from the face to the neck and it's just a smooth line. So you want to create that differentiation and that proportion with that jawline there, and it makes a huge, huge difference.
Yeah, I mean, for $2,500, I mean, I think that's a great deal.
Yeah, that's a slam dunk. If you have that issue, there's really no reason to have a double chin anymore.
Right.
Unless you want it.
Yeah, big old Omel saying, damn, they were doing me dirty. Doing me dirty, absolutely. Okay, yeah. So
don't get me wrong, I like beer.
So I mean, look at how nice and natural this looks, right? So she's got, that genetic mishap, and I don't know why our bodies do that, but it does in some people, right? And then after treatment, she looks amazing.
And you can see this. This is an older lady, and she has a little bit of looseness to the skin there. So those of you who are concerned about looseness to the skin, it tightens up quite nicely. Now, obviously, there's going to be some limitations per individual, but the results are typically very good. I had a patient today, one of the chins that I had treated today, she had a facelift prior, about 5 years prior, and so she still had fullness in the area. So it's something that I think that, just like with the tummy tuck, how we can avoid the tummy tuck, I think in many cases we can avoid a facelift in doing the liposuction to the chin.
Sure. It's very non-invasive. Yeah, so you had 2 patients today, and they were both older ladies, Yeah, and I was in the other room working on another patient, and he cranked him out before I actually got done with my patient. So yeah, it doesn't take very long to get through the chin procedure, and you can have amazing results.
Yeah, I love these results.
Like Gilzette
it's
from
so
Florida, and she looks amazing. I mean, look how youthful she looks.
You see how the face is now oval as opposed to square, and when you fill in and down here, it makes the face very square, and so when we take the face, it creates that roundness, and you see that clearly with this, and it's a completely different look. I mean, she literally looks like a different person, and this is just what, like a couple weeks after.
Yep.
It's incredible.
Okay, so wait for those stars to come up. Oh wait, I've been looking at like Instagram.
Yeah, no,
it's supposed to come up on Facebook.
We got 250 stars. We're rich.
All right, sweet. Do you have to buy the stars in order to like send them?
That's a good question.
Oh, okay, cool.
We look at Johnson Vonda. She's got a star next to her. So she's the one that sends us the star. I think that's.
Okay, cool.
I don't know. Maybe it's not.
There we go. Sweet. Appreciate your help.
So once you send stars, you get stars next to your name. That's pretty cool.
This is the winner.
Facebook stuff, huh? Okay, she purchased them. All right. All right. Where do you get the stars?
So was that Francesca Irium?
Yeah. So can you do all in one, upper body and face, midsection and lower body all together? If you don't mind being 6 feet underground, we can do it all at once.
So anybody that says, yeah, I went to whatever surgeon, and they said that they could do from here all the way down to my thighs in one setting, there's a couple of things probably going to happen. You're not going to get the results that you want in any one specific location. And B, it's a lot of work. If they do get it all out appropriately, it's going to be really, really taxing on your body. And you're going to have to probably stick around the hospital for a while, a couple of days, and make sure that all of your electrolytes stay okay. You don't go into surgical shock. It's just make sure you don't get any infections. I mean, it's just.
So we don't do that.
A lot.
Yeah, we don't do that. Everything that we do is under local anesthetic. And the only places that they would do stuff like that would be Mexico or Colombia or Tijuana or something. Something not in the United States. They don't do that in the United States. But I can tell you that we have had quite a few patients that go elsewhere and they try to do excessive amounts of liposuction. And the way they do that is they simply skimp out on all the areas. Instead of getting the maximum amount of fat out of one area, they spread it out over the whole area that you want them to treat, which is too large of an area. So they get a little bit out of everywhere, which means that you get crappy results all over the place. And which then means that you need to pay to get them fixed. So.
Which is really kind of interesting because things come in waves, and for some reason we both have just experienced a lot of patients that have gone elsewhere, and they profess that the pedigrees of these particular surgeons were really, really good, and they just weren't happy with the results, and so we've been doing a lot of evaluations on patients to get revisions done.
Yeah. So you see how this is just the front of the abdomen here, and doing just the front of the abdomen on this individual it's a significant amount of fat. I mean, we were really pushing the limits just to get that out. Now, if you want to try and do other areas on the body, then you're pushing it so far beyond the established limits of safety that you're putting yourself at a high risk for major complications, if not death, theoretically, especially when you're trying to do full body stuff. Yeah. I would never recommend that to a family member. I just wouldn't do that.
So I'm going to take that one step further. In taking out that much fat, it is risky for your body, just like going to some of those places that do it. The United States has these high medical standards for a reason. So some of this bad stuff happens. I get it in the United States. Sometimes cases are very unfortunate, and for whatever reason things go wrong. A lot of those are probably attributed to those liposuction mills in those high density areas like Miami or wherever in Florida. But bottom line is we're held to a very high standard, and so you come to us, we're gonna make sure that your process is done very efficiently, and yet always observing, what's paramount is your health. So,
You know, didn't Kanye West's mother die? And
from Lipo?
it was one of.
Oh.
I believe she was getting like a facelift, boob job, and liposuction, and like something else. So a lot of these plastic surgeons do these things where, because they put you under general anesthesia, they think they can just do everything on your body. And the bodies have limitations. There's only so much that your body will take, and then before it starts shutting down. So
Bottom line is like, what are you going to gain from going to like a third world country and having some sort of complication and dying, right?
Yeah.
Then you can't even enjoy your results.
Yeah, I mean, these are cosmetic procedures. I like people to think of this as a journey, and it's not something you have to get everything all at once. It's going to take time. The rest of your life, it's just a constant improvement with your life, and get these one procedures at a time, and take care of your problems one at a time. If you try and do it all at once, it gets overwhelming, and it could be not so good for you.
Yeah, but that's not the way our society is right now, right? We want everything all at once, but to those that can actually understand it's a journey and it's a process, I mean, you can find them on our support group and you can interact with them. People like Rebecca, people like Stacy, Obi-Wan Kenobi, right? So they plan for it and they say, listen, I'm ready to do something different with my life. I'm ready to move on. I'm ready to change a lot of my habits. And they plan for it and they come back for multiple procedures and they commit to a lot of lifestyle modifications.
Okay, I was gonna go to Colombia, but regret it after.
So I mean, listen, don't get me wrong, okay?
Colombia's nice.
There's
it really
a lot
is.
of places that they push the envelope. The problem is like if something goes bad, like.
Yeah.
The medical standard is just not as high as it is here in the United States, and that's just where it comes down to.
So ultimately, you have to do what you feel comfortable with.
Yeah,
that's it.
Yeah.
It's your body, and you make the choices. And you can go on like someone else might say, "Hey, these guys are crazy. It's totally safe. You should do it."
Right.
And you got to either you believe them or you don't believe them. And if you believe them, and then you go through the process and things don't work out well, then then you're gonna be the person to tell other people, "Hey, this is not a good idea. Don't do that."
So case in point, I have, there's a large volume of people in my small town that has been going down to Tijuana to do the gastric bypass. Okay, I had a very close friend that went down there, and I asked him. I said, "What are you doing? Are you nuts?" And he goes, "Well, I did my research. I felt comfortable with it, and it worked out great for him." Okay, cool, no big deal. Another classmate that we went to school with. Same thing. She had 5 kids under the age of 12. Went down there, had some sort of complication, passed. They can't get the records, and it was horrible.
5 kids?
Yeah, 5
Damn.
kids.
Deal Junkie says, what is the max amount you can take out at one time? Also, I was told I was over the max BMI for the place in Florida. Do you have a max BMI number? So, Deal Junkie, you're obviously on the larger side. Go through our quick quote so you can see, I mean, we deal with larger people, and, depending on your BMI, there's going to be specific pictures of individuals just like you. The quick quote is pretty cool. It's dependent on what your BMI is. Everything that pops up is dependent on what your BMI is. So you're going to get the pictures that are other people that are just like you, so you can see some idea of what you might be able to expect. In a lot of cases, the individuals that are in the same category, they look similar. They have similar traits.
Similar body styles,
Yeah.
carry their weight in the similar areas. So listen, we use the BMI to help categorize you, okay? Because that gives us a good indication where you carry your fat, how much fat is there, and how much work we have to do, and how well you're going to tolerate it. So we do not have a restriction as far as like what the BMI is.
Yeah.
So Felicia says, yo tengo mucho grasa en la espalda que puede hacer el doctor esa piel plácida. Okay, so what she's saying is she's got a lot of fat in the back,
Okay.
and she's wondering what the skin is going to do because she thinks it might be a little loose.
Right.
Bueno, depende de su cuerpo y dónde se lleva toda la grasa en su cuerpo. Tratamos algunos lugares en particular, y si solo tratamos esta área, eso da su piel la oportunidad a regresar y ajustar mientras que está cenándose, ¿ok? Y no tenemos ningún cliente que ha tenido un tummy tuck. Todos los resultados que tenemos son naturales, solo, bueno, no son naturales, solo es liposuction. Y se nota que el pie se regresa donde estaba antes de se engordó. Entonces, me imagino que la tuya pueden regresar también. So I just said we don't do tummy tucks and skin will return.
Is that what that means?
Uh,
What does that mean?
so she said, espero que me responde, estoy
Traumatizada.
traumatizada. So maybe she had like a procedure and she's got some
Yeah.
saggy skin. Bueno, se puede contactarnos por correo electrónico y fijar una consulta con nosotros y podemos ver su cuerpo y qué podemos hacer.
Bellissimo says, would I need a tummy tuck? Now, a tummy tuck is a desire, not a need. So if you feel like your skin is loose and you want to cut it away and pull it down, that's your desire, not a need. You don't need, no one needs a tummy tuck, but just as no one really needs liposuction. You can see from the results that we get that the skin always tightens up. It doesn't matter how big you are. We have very large individuals, the skin tightens up extremely well. And those folds, you know, they're going away on even very large people with their BMIs in the 40s. You see this individual, you can't even see her underwear, and this is just like a month afterwards, and she's still very swollen, which is super exciting because she's just got a little bit of that roll down there at the bottom, and I think as soon as that swelling goes away, that fold's gonna, that fold's gonna go away too. So again, most of our patients are looking to avoid a tummy tuck, so getting liposuction first. In all likelihood, you will be able to avoid a tummy tuck. But if you still feel that you want it, because you may have looser skin, you might feel like you want it. If that's the case, it's way easier to do a tummy tuck when all the fat's gone. The problem is when they do a tummy tuck when you're still big, they just don't do enough liposuction. It's just they just don't do it. And the reasoning is if they degrade too much of the blood supply, that big wound at the bottom won't heal. So their primary goal is to get that big scar to heal. Okay, how far apart do we do each procedure? So we want a minimum of 30 days, sometimes longer, and ultimately it just depends on how you're healing. But we wouldn't entertain anything before 30 days. And if you're not doing well, we may recommend that we push it out a little bit longer.
Drink too much water.
Okay, Johnson Vonda says, my BMI is 25.4. I'm 5'11". Dang, 5'11". That's pretty tall for a girl.
It is, yeah.
184. Okay.
So I think, so she's category
That's
1.
category 1.
Yeah.
So go make sure you do the quick quote, Johnson, and then if you're ready, you want to move forward, then get that consultation.
Yeah, so I'll tell you right now, if you're category 1 and you want to do a abdominal 360, it's $6,000. Yeah.
Okay, Heck Marie. So I'm in my case, I weigh 130 pounds. I just want to transfer fat to my breast and the butt. Would I have to gain a little weight to do the process? Well, the first thing to let you know is that it doesn't make sense to do fat transfer to the butt and the breast at the same time. And the reasoning is that the recommendations following fat transfer is to put no pressure on the area for 2 weeks and limited pressure for 2 months. Now that becomes a problem when you can't sit on your butt and then you can't lay on your breast. So how do you sleep? Now I thought about this, and I think theoretically it is possible. In theory, I've never had anybody that's done it, but I think theoretically it's possible. But I wouldn't necessarily want to be that person that had to try to sleep without laying on my back or my front. It can be done with pillows. I think that's how it can be done. But I wouldn't do it.
So listen, if you're gonna invest in your body, why would you want to you want to give your body the best opportunity for that fat to take, and so it's better if we just do it one at a time.
I can understand she's smaller already. So if you're small and you're already concerned about not having enough fat, we really need to maximize the amount of fat that we have to focus on the one issue. So if you want to expand out the butt, then we should focus on treating around the waistline to transfer the fat to the butt. And then the second procedure would be trying to get the fat from somewhere else and transfer it from the breast. So if we are unable to get enough fat, the recommendation, if you're too lean, the recommendation would be to gain some weight, usually around 10-15 pounds is reasonable, and fills up those fat stores.
So there was a question on if we do this in a hospital or if we do it in our clinic. Bueno, tenemos una clínica donde se hacemos los cirugías, ¿ok? Es bien fácil, se puede hacerlo en una clínica y no necesitas un hospital.
Okay, would I have to be asleep during the procedure? No, you're not. Everything that we do is under local anesthetic while you're awake. It's significantly safer, and the patients do much better following the procedure. They feel a lot better because a lot of the medications that you use in general anesthesia are detrimental to the entire body. Whereas our medications only stay local, so they don't affect the entire body.
So it looks like Steve just joined in. Steve, thanks for joining in, bro.
Yeah.
So guys get this procedure too. Yeah.
You know, I think the cool. Go back to that picture really quick. Sorry. The cool thing about this picture here, you see, as you gain weight, the body will naturally do certain things. Gravity starts to pull down on the skin, pulls down on the fat, and so you get these. You see with the belly button, it's got like this sad face look to it, and it naturally happens as you gain weight and gravity's pulling down on that weight. So with the liposuction, you simply remove that volume and the weight is not there for gravity to pull on, and it changes everything. And you can see how quickly that abdomen changes, the belly button changes, and it looks, so much more normal.
So, this belly button, even though these are significant, results. My buddy, who started having kids, right? We're aging together. We're all about the same demographic. He calls this the milk dud belly button.
Milk dud.
Milk dud. Do you remember the milk duds?
A little milk dud.
Yeah. The bottom of the milk dud. How it has like irregularities.
Yeah.
This is the frowny face, and we changed it. We transformed it to the milk dud. And then the next step, make it even better.
Yeah.
So.
And she's got great results, but when she continues with her lifestyle changes, these get even better. So it's so important to change the lifestyle that if you don't change your lifestyle, it's almost not even worth doing procedures like this, because it's just a matter of time until you recreate your same problems. And it's way more fun in the long term when we see you continue to be great.
Yeah, whenever when we see you posting like a year out, 2 years out, and you're out doing the things that you won't do now because of whatever you're hiding. That is the most rewarding part about our job. We do this because we enjoy it. We do this because of the change that is effectuated in people's lives, and it's contagious. I feel like we give good karma to the universe.
Yes, and it comes back.
And I'm not sitting in front of a computer just staring at numbers or like reading reports, man. That would be boring. I actually, I have the opportunity to where I get to intervene in a positive fashion.
Instead, we sit in front of a phone and talk to it as if we're talking to a bunch of people.
But I mean, this is just a small portion of what we do.
Right.
Like the real magic happens when you put liposuction cannulas in our hand.
So Deal Junkie says, what if I want to be asleep? Isn't it very painful? So the part that we inject the numbing fluids, and since you're not numb yet, just like when you go to the dentist and you get your teeth numbed, the first injection you're gonna feel it. So since you're not numb yet, once the numbing medication takes hold, you don't feel a whole lot after that. However, you will still, since you are awake, you'll still feel and have sensation in other parts of your body. You'll feel pressure, you'll feel vibrations, you'll feel the movement, the tugging and pulling sensation. All that stuff is normal, but the hope is that the pain, the actual sensation will be blocked.
There's Tricky Mickey right there.
What's up, Tricky?
Tricky Mickey does not let her, limitations as a truck driver like impede her from living her best life. I see her trend setting all across the globe. She met up with a couple of our previous patients, and they had a good time out partying, and out socializing. And she's on her way back, and we're gonna finish off the waistline.
Yeah, she's coming back. So we took care of the front of the belly here. We're gonna get the rest of the waist to complete the 360. Says Anamara says, after lipo and BBL, how long do I have to wait to start work? So it kind of depends on what kind of work you do. If you have a very physical job, it might take a little bit longer. If you have a sedentary type job, you can go back pretty quickly. Now with the BBL, the limitations are you're not supposed to sit for 2 weeks and limited pressure for 2 months. So ideally you limit the amount of sitting you do for the first 2 months. And I would suggest looking into like a standing workstation. So if you have a sedentary type job, try and create a standing workstation. There's all kinds of options for that. You can go look online.
So Miss Nurse Elisette joined, and listen, I just want to give a shout out to all the nurses. I've worked in the hospital setting. I work in the ER. There is not a more thankless job. I mean, the amount of abuse, verbal abuse, physical abuse, and just, tireless effort that they, basically put forward to do their job is very commendable, and we love working on nurses. So, we absolutely, we roll out the red carpet for everybody, but we really like it when we get to intervene on a nurse's life because just we know how stressful it is.
Yeah. So we're gonna finish this up here now. If you are serious, and even if you're not serious, you just want to get some prices, go check out our quick quote. It's quick, it's easy, it's free, and you don't have to submit any pictures. You can get some basic pricing for our most common procedures. Now, if you're serious or you have more complex questions, then you're going to want to schedule our formal consultation, which is $100 for that. Both of these consultations can be done through our website, myshapelipo.com. And so when you're ready, we're here for you. You can also call our office if you have any questions or concerns. So I appreciate each one of you for stopping by today. Thank you so much, and we'll see you next time.